Good afternoon. My name is Margaret Horisky, and I'm delighted to introduce our next session, Reimagining Our Core Services for Telecare. I'm going to pass you over in a minute to Anne Murray, who's our National Tech Telecare Lead in Scotland. But just by way of introduction, I would just like to emphasise the importance of telecare within Scotland and support to our vulnerable citizens. Also, this is the third of 4 sessions on telecare. So we had a really interesting one, which was focusing on our twinning with Spain and with Norway on looking at a roadmap for digital telecare. We also had a really good session on the analog to digital telecare transition. So I'm delighted to hand you over to Anne, who's going to share with you, along with some colleagues, about how we might reimagine our core services for telecare. Thank you.
Thank you, Margaret. Good afternoon, everyone, and thanks very much for joining our session today. So, as Margaret says, this session is on reimagining our core services for telecare. But what we're focusing on today is how we can reimagine telecare and shift to a more anticipatory and preventative approach, which will improve the experience for the people who use telecare. So in this session, you'll hear from my colleague from Wales, Julia Wilkinson, who's the transformation lead in Carmarthenshire County Council. And you'll also hear from Dr. Lynne Douglas, who is the Chief Executive Officer in Bield Housing and Care. And I'll also provide a bit of an introduction to the session as well. So we recorded our presentations a couple of weeks back, but I'm delighted today that I'm joined by Lynne Douglas from Bield, and the two of us will be available to answer questions at the end of the session. So please do use the chat function to add some questions, either for Lynne or myself, or any comments, and we can come back to that at the end of the session. So thanks again, and I'll hand over to myself, who's going to start the first presentation.
Good afternoon, everyone. So just a little bit about telecare services in Scotland. Around 182,000 people currently receive telecare in Scotland. Some will receive their service through housing associations, housing cooperatives, and other independent providers. And around 137,000 people will receive their service through their local authority or health and social care partnership telecare service. So in Scotland, our 22 alarm receiving centres manage around 5 million alarm calls every year. So around 75% of those are currently incoming calls. The 25% that are outgoing calls are typically in response to an incoming call or a routine check call, just to check that equipment's working or records are up to date. So in Scotland at the moment, telecare is predominantly a reactive service. It responds to an alert or a contact. And this offers really important peace of mind to the person with telecare and also their family, that if something happens, then an appropriate response will be activated by a remote care worker. And this peace of mind really can enable independence. What we also know, though, is that around 2/3 of people who have telecare do not have any home care. So that's around 90,000 people. Now, many of these people will have good support circles. So they'll have families, friends, communities, maybe private care. But what we learned during COVID was a lot of these people also don't have those kinds of supports. They don't have people who check in regularly and support them to keep connected and to keep active. So we believe that there's potential to support these people and others with a more proactive approach to telecare, enabling well-being, but also anticipating and preventing crises so that people can continue to live independently at home without the need for other statutory services. Next slide, please, Nessa. Thanks. So what do we mean by proactive telecare? So TEC have been working with the Digital Health and Care Institute to really define what we mean by proactive telecare. So this is our working draft. So we feel that proactive telecare has a deeper relationship with its service user, gathering insights into patterns of behaviour and preferences over time, which could provide a more anticipatory and preventative service which is tailored to the individual. Proactive telecare also provides potential for greater integration of telecare with other health and care services, the third sector and communities. And if I go back to that gathering insights into patterns piece, I think in time, when services have transitioned to digital telecare, there will be opportunities for greater integration of data and for data to power preventative approaches. However, in the meantime, if we better use our existing intelligence and add into that good conversations with customers and regular check-ins, we can begin to work in a more proactive way. And listed there are a few of the potential components we could have to a more proactive service. So you can see outbound calls and reassurance tailored to the individual, providing information, support for carers, promoting physical activity and exercise and social contact, and also continue to provide that backup that the majority of services do just now of a mobile responder who can physically attend if that's required. Can I have the next slide, please? Nessa, thank you. So if you were to ask, well, I think first of all to acknowledge that a more proactive approach to telecare is not a new concept. And I think if you asked people who work in telecare about proactive telecare, they'll probably talk about services in Spain. So services in Barcelona, so Catalonia, and also in Andalusia in the south of Spain have been taking a more proactive approach for a number of years now. And they report that service users are living independently for longer, that there's reduction in emergency calls per person and a reduction in ambulance call-outs as well. And they have really good feedback from service users, consistently reporting they feel more self-sufficient and they feel safer. And there's also overwhelmingly positive feedback from families who report many benefits from this approach as well. Now, Scotland is actually currently twinned with Andalusia in a Digital Health Europe project, and this is providing a great opportunity for us to learn more about their approach. And what we learned last week is that 90% of the Andalusia calls are outgoing, and that compares to 25% in Scotland. So we've got a lot we can learn there. Now, I've also put there the DHI logo, because DHI in Scotland continue to explore next generation solutions, and proactive approaches, preventative approaches, use of predictive analytics are very much at the heart of these solutions. So as I say, it's not a new concept, but it's something that we want to start testing now. So can I have the next slide, please, Nessa? Thank you. So thinking about a bit of context and why it is we're doing this now. Well, first of all, there's the policy context. And in Scotland, our national policy is that the health and social care system will focus on prevention, anticipation and supported self-management. So for me, this is about thinking, what's the telecare contribution to that policy? If we move on to catalysts, well, in January this year, this document was published. It's a review of telecare call handling in Scotland, and it had a number of recommendations, but one was that we would move to a more proactive approach with telecare as well. And I remember reading this back in January and thinking what a huge step that sounded like. And then within the space of a few months, we were in the middle of a global pandemic. And almost immediately, around half of the telecare in Scotland started providing wellbeing calls to their customers. And I think of equal importance, they started working much more closely with other services and organisations, including the third sector. And that's to ensure that the needs of their customers were being met safely. Now, this represented a significant change in practice in Scotland, but it also brought about a significant change in attitudes towards a more proactive approach. So that's been our biggest catalyst. Just briefly mentioning opportunity there, because I've mentioned it before, and that's the imminent shift to digital telecare and the potential for a more data-driven preventative approach. Could I have the next slide, please, Inessa? Thanks. Okay, so what are we going to do? Well, what we want to do is build on the learning and the successes of COVID, and some of that learning, of course, is importantly from the people who've been receiving these calls. So the tech programme in Scotland is going to fund 4 telecare services. That's going to be 3 health and social care partnership telecare services and 1 housing association. And we're going to fund them to develop and test proactive outbound calling as a sustainable enhancement of their existing service. What we hope to do over a 6-month period is gain rapid insight into the practicalities, challenges, benefits, the pitfalls, but most importantly, the scalability of working proactively as well. So to maximise the learning across these 4 sites, Tech are going to facilitate a proactive learning collaborative. So we're going to work with the 4 sites for knowledge exchange, to share learning and experience and ideas and successes and things that don't go so well, because I'm learning from that. We're going to do problem solving together, and hopefully there'll be opportunities to co-design aspects of their tests as well. And just to mention, the Care Inspectorate will be partners in the collaborative as advisors, but also to gain an understanding of emerging new service models as well. So our first meeting is of the collaborative is on the 9th of December. Now, as we prepare for this, over the last few months, we've been looking to our colleagues in West Wales for learning, for advice and for inspiration, and they've given us all of those things, because we believe the Connect project in West Wales and Carmarthenshire is leading the way in proactive telecare in the UK. So I'm delighted that we have Julia Wilkinson from Carmarthenshire to present here today. We also have Lynne Douglas. Now, Lynne is the Chief Executive of Bield Housing and Care. It's a housing association, but also they provide one of the 22 alarm receiving centres in Scotland. So delighted to have Lynne here. Bield are going to be one of our test of change sites, and they'll be joining our learning collaborative. So just want to thank them both for joining us today. So I'm just going to hand over now to Julia.
So I'd like to share a presentation with you today about some of the learning that we've experienced through our proactive technology-enabled care service that we've delivered across the region of West Wales. So my name's Julia Wilkinson, and I work on the integrated transformation of health and social care. To put that into context, Nessa, if you could go to the next slide. In Wales, our legislative landscape is quite similar to Scotland, I think. We've evolved through a lot of learning about how we need to develop much more proactive care pathways and focus very much on the preventative agenda. This started with a bespoke piece of legislation that we've got in Wales specifically called the Social Services and Wellbeing Act, as well as another key law that we've got in Wales called the Wellbeing of Future Generations Act. What these 2 acts tell us is that we have to focus much more on well-being, prevention and proactive care and support, rather than relying on the crisis-driven model that we had previously within health and social care. And for me, I think that's a bit of a macrocosm of the microcosm in which telecare works. Telecare was always a very reactive service, with people in large call centres waiting to respond when crisis occurred. And I think the focus that we've got now on a more proactive telecare approach kind of reflects the change that we have across the sector as a whole, to say that we have to use resources much more wisely and much more prudently. Again, a concept that we've got in Wales around healthcare, about prudent healthcare, that we really use our resources effectively and focus on outcomes, and a proactive preventative approach often deliver those really vital outcomes that we need for our population. So you can see in the middle of that presentation there a lovely photo of a little boy there saying that what we want is a healthier Wales. And in 2018, we had this key document that was published to say we need to move to a healthier Wales. And the way in which we're going to do that is to focus on 4 key objectives. And that's called the quadruple aim. So if I go on to my next slide, I can explain to you a little bit about the quadruple aim and how our proactive technology-enabled care service fits within the quadruple aim. So you can see there, we've got a partnership in West Wales called the West Wales Care Partnership. And what that is, that was defined by the Social Services and Wellbeing Act as a partnership approach that we need around health and social care to bring stakeholders together. And in West Wales, that means our health board, which is Hywel University Health Board, the local authority areas of Carmarthenshire, Ceredigion and Pembrokeshire, but also, importantly, third sector independent representation on that board to make sure that we work across the whole services to create a seamless approach to health and social care. So what the quadruple aim basically says in a healthier Wales is that we need to move to services of well-being that focus on better health, better care, better value, with a workforce that is supported and enabled to be able to deliver that change. So as part of a healthier Wales, the key highlight, I think, for a lot of us working in services was that to enable this change to a more proactive, preventative approach, that Welsh Government was supporting the whole of Wales with a significant amount of money. That was £100 million that was awarded to the whole of Wales for regional partnership boards to put in bids to Welsh Government to explain how we were going to deliver the ambitions associated with a healthier Wales. And in West Wales, we already knew that we would like to make our flagship programme around proactive technology-enabled care. So I'm really interested that Anne spoke about Spain being the kind of exemplar for the way in which proactive technology-enabled care has been rolled out across the world. And we had already looked to Spain to see how we could adapt that model in Wales. So about 6 months before A Healthier Wales came out, we'd already started working up business plans around how we were going to pilot a Spanish-based model in West Wales. And what the Transformation Fund gave us was pump priming to really deliver those ambitions on a much wider scale. So what we did was we went to Spain and we looked at how they developed that model in Spain. But really importantly, we said that we cannot just take that model and transport it into a Welsh context. We have to adapt it for our legislative context as well as our delivery mechanisms, and really importantly, look at how we already deliver a proactive care approach. I think there's been a lot of interest in how Spain deliver their services, but it's never been replicated anywhere else. So the Barcelona model started, I think now about 12, 13 years ago. And in that time, it's never been successfully transported as far as I'm aware. So we have to take a key learning for that and say, we really have to create a different bespoke model for a specific environment. And I think that's what we really focused on in Wales. We looked at our legislation, we looked at our assets and strengths that we've got in Wales and took very much what is fundamental to our legislation, an asset-based approach on how we would deliver those services in Wales. And if we go on to the next slide, I can say we were really successful in that bid to Welsh Government, and we were awarded across the board £12 million for the region to deliver a holistic transformation programme of health and social care, of which our proactive technology-enabled care service was our flagship programme, which took up about 7 million of that programme overall. So if we just go on to the next slide now, I can tell you about what that proposal was. So we were awarded, as I say, 7 million across the region, and we adapted it specifically for the West Wales region. To put that into context, and I think especially to try and say why I'm so pleased that we are creating this relationship between Scotland and Wales to try and learn from each other. The area in which we are delivering this programme is across the whole of West Wales, which covers up about a quarter of the landmass of Wales as a whole. We've got areas of great rurality, as well as quite urban areas of significant deprivation. And we support around 384,000 people across that region. So when you go back to the Barcelona model, just in Barcelona, they this equivalent amount of people as Wales as a whole. So their financial sustainability of that model is very much around economies of scale. So what we had to try and think with this proposal was how we inbuilt financial sustainability on a much smaller scale. So if we go on to the next slide now, I can tell you a little bit about what we wanted to achieve. Fundamentally, what we wanted to achieve was the ambitions of a healthier Wales, which was about moving to that proactive approach to health and well-being, so that we're really supporting good health, well-being, but that is very much about people helping themselves through an early intervention and proactive model. Across the region, we've got a model of support that we communicate with the public around what support that we'd like to offer them. And we go across tiers of service, which is about providing help for strong communities, help to help yourself, help when you need it, and ongoing specialist help. And our proactive technology-enabled care service is a core service of help to help yourself. I think I've mentioned it a lot, our proactive care offer, how we're really promoting self-care, self-management outside times of crisis to build resilience and well-being. So we really want to strengthen an integrated locality model as well. This is very much about seamless pathways of care between health, social care, communities and the third sector. So we're delivering a place-based approach to well-being where we are able to monitor people and respond appropriately through tech and digital monitoring. Part of our programme is very much about looking at social isolation and how we're proactively supporting people to connect. And I'll go on later to tell you about why we came up with the name Connect for this technology-enabled care programme, but actually our whole transformation programme, it is all branded under that title Connect, because we feel taking feedback from and co-designing our services with citizens and communities as a whole, connecting people to the right support at the right time and being able to ask for help when people need it is absolutely vital. So that connection is a fundamental element of our offer in West Wales. So if we go on to the next slide now, I can tell you a little bit about what our model of support is. I really would encourage you to ask questions in the chat because we will be here to answer those questions. I'm aware, I've got limited time, and there's a lot of detail that sits behind this service and a lot of work that has gone into each process within the part of the programme. So the way we designed the service was that as people come into it, they have a bespoke assessment that is focused specifically on this service and does not replicate a statutory integrated assessment defined under our Social Services and Wellbeing Act. Individuals obviously will go through a statutory assessment should they need it, but as a preventative, proactive service, we really want to take an asset-based approach and look individually at people's strengths and areas that we'd like to support them on as part of this proactive service. So we do a very defined and prescriptive assessment that is based on 3 domains of well-being. It's based on an evidence-based approach about what supports well-being. Those domains are related to physical health, mental well-being and social connectedness. That assessment then takes those domains of well-being and asks much more prescriptive questions, that has a red flag system that would flag up the need for a statutory intervention at any time during that assessment. What that assessment then does is feeds in again to quite an innovative plan, which is called a Connect to Wellbeing plan. This Connect to Wellbeing plan is also an app-based services. It's a stay well plan that individual participants on the programme own for themselves and are able to write, review and deliver themselves as part of this app, which acts as a digital navigator for services in the area, advice and support as well. So that individualised wellbeing plan is all based around Connect to Wellbeing and the domains of life. If anybody's interested in that plan, I've also got a more detailed description of how we plan across those domains, which I don't have time to go into today, but certainly we'll be able to share with you. From that individualised wellbeing plan, we support people on a number of different pathways. The first being proactive wellbeing calls. I think what's really important about these proactive wellbeing calls is that they're not just a befriending call where we call people for a chat to ask how they are. There's certainly a role for that, but these proactive calls are much more about a coaching model of supporting people specifically on their wellbeing plan. So they're targeted very much from that plan to talk about the objectives that people have set for themselves, rather than just ringing up people to remind them about public health messages or just generally to check how they are. These are targeted to that person's plan and allows somebody to talk through their goals and what they'd like to achieve. That individualised wellbeing plan also looks at bespoke technology-enabled care, because that's what this service rests on. And that's done for an individual level. A general package for everybody would be a lifeline, would be a remote monitoring service, but obviously we can individualise that for individuals as they need. Vitally, we also, through that remote monitoring service, deliver an appropriate 24/7 response service. There's a whole suite of options that we offer through that 24/7 response. We offer a welfare response service, which is where we believe somebody has had a non-medical emergency. So those are things like non-injurious falls, but also for those of us who work in Telecare, we know a non-response call, also it's important to respond there. So we also, that welfare response unit goes out for non-response calls as well. We also have a 24/7 carers pathway, should there be instances of carer breakdown, where we can respond urgently to provide replacement care for carers. We also have got, obviously, a medical 24/7 response, but not just escalation to Welsh Ambulance Service, but also our community virtual ward model, which is our acute response teams across the region, which provides a 2-hour response time of a multidisciplinary team. Also importantly, within that wellbeing plan, we recognise the importance of building appropriate proactive care and support pathways. And for me, this is absolutely vital to the model. We would, if we build in a proactive technology-enabled care service, but within that don't recognise that if people are representing a decline or need support, if the only support mechanisms that we build into this is a referral to a statutory response, then we have failed before we've started. And I think this may be why we haven't been able to roll out the Spanish model in other areas, because we haven't properly assess the need for a proactive pathways of support within a technology-enabled care model. So what we have done is, within the Connect model, we've looked very much to community services, proactive care pathways, to build in those referral models, so that there's a suite of options to be able to refer for support and help, not just that statutory offer. So if we go on to the next slide, I can tell you a little bit more about those proactive pathways. As part of the programme, each participant gets a wellbeing navigator that delivers that wellbeing plan with them. And our proactive pathways, our prescribed ones are, we would give somebody a digital support plan. So that not only would be technology-enabled care, we've also created an adapted tablet for our service users that has embedded in it a project called Connect to You. Connect to You is a virtual social network scheme where we create virtual networks of friendship based on areas of interest and assets, rather than just artificially trying to get people together. We've also got a specific carers pathway. I mentioned about the 24/7 carers response. We've also added additional capacity in the third sector with carers information service and outreach services that look very much at a proactive approach to supporting carers. Our cohort, when we started this project, has been predominantly older people, and we really know that falls is a significant issue for that service user group. So we've really looked at how we are embedding a proactive approach to falls. And what we've done is, through this programme, we have funded a 32-week falls prevention digital programme, as well as coordinating a proactive falls approach. We also looked at how individuals support their own self-management through an innovative programme in Wales that we've got called the Education Programme for Patients, which we now support digitally. We also look to the third sector and provide funding for the third sector for bespoke support for individuals and a more of a wraparound service, as well as looking at cognitive impairment, cognitive stimulation programs, as well as an adapted offer for those living with dementia and their carers. So those are our proactive pathways of support. If I go to the next slide now, I can tell you a little bit about the model in which we have delivered that service. So in West Wales, we're really lucky to have an organisation that can support this approach across the whole of the region. We've got a company, a local authority trading company called Delta Wellbeing. This is a company that's wholly owned by Carmarthenshire County Council, and it's the largest provider of technology-enabled care in Wales. What we are able to do with this company is we've commissioned Delta to deliver the core services of the Connect programme. And what they do is they act as a conduit between the third sector and community-based services and escalation to statutory services. We've taken feedback that a lot of individuals don't want to come to statutory services to proactively ask for help. They would much prefer to go to a more neutral source, and usually that's somebody in the third sector. And for us, Delta provides that middle ground. They are linked very much into the third sector, but also have links to statutory services. They have an MDT, which is based within that service of nurses, social workers, OTs and physios that are able to screen and provide advice around our cohort to refer on to a statutory offer just at the right time, and make sure that we are maximising potential for preventative and proactive activity as much as possible. a proactive technology-enabled care service can't act in isolation of the wider pathways of care and support that health and social care services provide. A delivery model has to be a collaboration with third sector, individuals and communities and statutory partners. And that's why we think our model, where our local authority trading company acts as that navigator between those partners, works really, really well. So I'm going to take you on a little bit about what we've delivered to date. And again, Anne mentioned in her presentation about the challenges that we've had because of the global pandemic. So we started delivering this service in February 2020. I think you will agree that's quite a challenging time to start, because obviously the next month we had the impact of COVID and what that meant, not only for individuals and the effect on people's well-being overall, but the impact on services as a whole. We were really keen to adapt the model because we believe if there's a time in which it was needed now. So we started in February, and to date we have recruited 1,400 people. And I think to put that into context, the success that we've achieved from engaging those people, that's obviously all of the assessments were planned to be done face-to-face. A lot of the aims of the project was to digitally include people, and a lot of the assessments now are being done digitally. So the fact that we've been able to engage with those people, install tech in people's homes and deliver wellbeing plans to them has been a real testimony, I think, to the strength of the project as a whole and the impact that it's had on individual well-beings. Individuals' well-being. We're really focusing on the difference that it makes to people. And I mentioned before this app that we've developed, which is called Connect to Wellbeing, where we're asking people the difference it makes to them and measuring our outcomes based on what they want to achieve. And we've started to measure that impact. We started doing that through a paper-based assessment, and we've now moved digitally to this app where we're measuring scores, and we can evaluate in real time the difference our services are making. I think fundamentally what we want is we want to create a sustainable model for this programme going forward. It has to be a mixed model of how we fund it. We all know the pressures of funding within health and social care, and we think that's the beauty of commissioning it in the way that we have through a local authority trading company with third sector partners, because we can look at a number of different funding sources to be able to sustain this long term. We've been lucky in Wales that our transformation funding has been extended indicatively for next year. So it looks like our funding is going to go up to March 2022. And again, that's a real mark of confidence that Welsh Government have given to us to say we understand that any proactive preventative models are a bit of a leap of faith, really. It's a bit of an invest to save model that you hold the line and you wait for those the impact to come, because a lot of preventative work, it's difficult sometimes to evidence its impact because you're proving things that you've prevented happening. And the fact of COVID really has kind of messed with a lot of the baseline data that we already had to be able to evidence the impact of this service overall. Emerging evidence, though, from when we've started delivering is very, very positive, not only in terms of outcomes to the system, so things, for example, like reduction in WAST call-outs, WAST is Welsh Ambulance Service, and a reduction of escalation to statutory assessments, but also individual well-being scores that are coming back from people who are experiencing the service. So going on to the next slide now, our next steps are really about how we embed this proactive approach into being the new normal, that to fund a proactive preventative service is a given rather than a nice to have. And I think the way that we evidence the importance of doing this is to focus on individual goals and maintaining individual well-being. We've already started on this becoming a telehealth and telecare model, because we think real cost savings to the system, as well as impact on individuals, will be that we deliver a social model of health through technology-enabled care, that we're also able to remotely monitor people's health through a telehealth approach through this. And fundamentally, what we want to do is empower people to live the life they want, increase independence, and allow people to help themselves no matter what their circumstances are. And we think, doing the right thing will ultimately reduce demand on statutory services, that people maximise their well-being and live well for longer. So I'd be really happy to answer any questions, and I really hope that you do post some questions about that, because I think I've not gone into detail about some of the areas of our services just because of lack of time. So diolch yn fawr, thank you very much for inviting me here today, and any questions, please do post them, and I'd be more than happy to answer them in as much depth as you would like. So thanks again for inviting me, and I'd like now to hand over to Lynne, that can start to show you a fantastic model that you're rolling out in Scotland as well. So thanks very much.
Thank you very much, Julia. So thank you very much for inviting me to come along, and it was really interesting to hear Julia in terms of what's been happening in Wales. My name is Lynne Douglas, and I'm the Chief Exec of Bield Housing and Care, and I'm just going to spend the next 10 minutes or so talking you through our ambition and what we're doing in partnership with Tech Scotland and the bid that Anne has previously described, and give you some of the high-level hopes that we have around our plans to move forward in this area. So I'm just going to give you an overview of who we are, why we're doing this project and why now, what we hope to achieve, and most importantly, how we galvanise on the learning and really begin to take this forward, both strategically for us, but importantly, how we can contribute to the learning nationally and in Scotland to aspire to get to where Wales are at the moment. Bield Housing and Care is a registered social landlord, and we are in 23 local authorities throughout Scotland. We have about 5,000 tenants, and most of our tenants are over the age of 65. We have a few that are younger than that who meet the qualification for one of our properties due to their health needs or circumstances. We have about 700 establishment in terms of our staff. We have over 1,000 people who work for us all over the country. And as you can see, we are very geographically spread, and we have to interface with a significant number of local authorities and also health and social care partnerships. And that does make my job very interesting in terms of trying to take something forward that really has such an important and widespread impact across the country. I think probably one of the most important things to say also is that our tenants and our customers, and we do have some owner customers who live in some of our owner developments that we factor for, but most of these individuals are living freely and independently, living their lives across their communities. And we do have a graduated system, as most social landlords have, that do care, where we have people who live freely in the community, but we also have people who are still independently living, but they require more assistance. And that could be from our Bield at Home care providers. It could mean with us providing meals for those individuals. And obviously we have technology-enabled assistance in many of our developments. So we were really excited to be part of the DHI and Tech Scotland project bid in terms of looking at how we could do a test of change and understand more greatly the whole concept of proactive telecare in an environment such as a housing association. And I know many people would probably ask me the question, well, why on earth do you want to do this as a registered social landlord? And I probably should say that I have spent the best part of 25 years working as an allied health professions director within a health board. And so my transference over to housing is really relatively new. And I have spent most of my working life trying to help people live independently within their own homes. And I've always been interested in the concept of prevention and how we assist the population in helping them to keep themselves healthy and able, so that they're actually able to successfully live independently in their own home environment. So really our adventure with Tech Scotland and the DHI has really been over the past few months to think about how we could partner with some of our strategic partners to do something that would be significant for our own population of tenants, but also to think about how we could interface with perhaps a different cohort of people and look at how doing proactive telecare can help them achieve personal outcomes. So we have been awarded a project grant, and we are looking to have two cohorts. One which is in our own tenant group who live in Midlothian, and we're working in partnership with Midlothian Health and Social Care Partnership to help keep these individuals living independently and functionally able over the next 6 months, and really learning a lot about how we do that and what we hope the outcomes to be. And it's really exciting for us to be working strategically with some of our partners and being able to do this piece of work. And our second cohort of people are a different type of individual, working with our partner in Renfrewshire, where we provide an out-of-hours alarm receiving centre service for. We're really interested in working with them in partnership to look at the people who are calling our call centre really frequently. And these individuals may have a higher level of need than the individuals in Midlothian, but we do feel quite strongly that we will be able to have significant learning from being able to incorporate two different types of individual who are living freely within our communities. The principles, very similarly to what Julia has described, we are really interested in this being grounded in health and well-being and very much having a personal outcomes approach. And I found this, there's a publication which was 2015 from Public Health England. There's a very interesting blog being written by Kevin Fenton, which I think this quote really, for me, sums up the synergy between health and housing. And really, housing is a place, is someone's home. It's as a social landlord, we are providing the properties, but in these properties are people's homes. And as it's a national ambition to keep our population living independently in their homes or in a homely setting, I think it's really important to recognise the role of housing and people's home as a valuable contributor to the place that most of our health takes place throughout our lives. So I'm really interested, coming in from health with a background in working across health and social care boundaries, to think about how we include housing much more in these integrated conversations so that we're able to genuinely look and see how we can improve the outcomes for the populations that we serve. So as I mentioned, the cohorts are linking in cohort 1 very much some of the aspects described in the Wales model is how we link our tenants with the community assets in Midlothian. And we're very excited about taking the same approach as they take around having good conversations and having very much the person in the centre and working with that individual to identify their needs, take a health and wellbeing approach, and looking to see how we link our community development team with Midlothian Health and Social Care Partnership team to be able to build knowledge around the assets that are available within that Health and Social Care Partnership, but that are available to our tenants. And sometimes people ask, why would housing want to do this? And one of the things I would say is that particularly when we have tenancies for older people, it's really important that we can sustain tenancies. And it's important that we can help individuals as their needs and health changes throughout their life course, it's really important that we can think of ways in which we're assisting their tenancy. So this is very much rooted in the very core of what a housing association is about. And I'm really very excited about being able to take this forward with some of our own tenants. And in cohort 2, equally, we would say that there's a significant contribution we can make with our local authority partner in helping them to find ways through individual personal outcomes of helping to keep that individual living safely in their own home environment and not having to escalate all the time to statutory services. And I think in the future, depending on the outcome, obviously, of our test of change, this will be a significant factor in what we want to talk about moving forward. And it's delightful to see that Wales are ahead of us, but it's such an important set of things that are being put in place for us to truly achieve that goal of improving the outcomes for our populations across Scotland. So why are we doing this now? Well, Bield Housing and Care, we are one of the 22 alarm receiving centres in Scotland. And what the slides, the pictures that you see here are some of my staff who man the alarm receiving centre, and they were all working. We managed to get them during COVID, which was quite a feat, but you can see this is them all working from home, being able to receive the calls and do their jobs. So we had really key learning from the outbound calling that we did over the first lockdown earlier in this year, where the team were making approximately 10,000 calls a week to various clients across the country, and people had to give permission to be contacted. But most people who we were in contact with were the most common things that we found were loneliness and isolation, and interestingly, mutual aid around food, and how difficult some people found it to actually continue to receive the shopping that they would normally receive from their own relatives, because many of their own relatives were actually in the shielding category. So we had a significant learning from our outbound calling, and it made us realise that the proactive nature of what we were doing was helping to prevent a crisis from occurring. And what we did notice also was that these calls took much longer than our normal calls, and so it was a significant part of our effort in the first lockdown. And working in partnership was also a very important part of what we did in terms of linking with community assets, enacting a regional volunteer system, which our own volunteers took part in, but also we were able to link our tenants with assets in the community. So we had a little bit of experience of trying to do that during the COVID lockdown. And I really honestly think that housing should be and is a very strong community anchor. It's something I'm very interested in terms of the public service reform agenda, and how do we think about housing developments in a different way in terms of being able to offer that role in that community in helping to keep people living independently in their own home environment, but also how we interface with our local communities in helping us improve the outcomes for individuals. Most importantly, as I've said a number of times, it's a very person-centred approach in helping individuals to live longer in their own home environments. So really, as I sum up, our implementation and learning, obviously we're very excited to get started with this project, and we've put together a small project group. It's a learning for some of my team, and we'll be working alongside a few others to help improve our knowledge around the improvement model, which is quite new to my housing association. And I'm very excited about the learning outcomes from working collaboratively across our stakeholders. And I mean that in terms of all of our stakeholders, because we want to know what enables these projects to go forward, and what are the barriers, and how do we find a common goal. Because the tenants I have in Midlothian are also Midlothian Health and Social Care Partnerships clients and patients. And it's how we think about linking more and using all of our assets to help that individual achieve the outcomes that they're looking for. We are obviously focusing very much on what our customers and our tenants want, and that will be the very basis of what we do moving forward. we are very excited about trialling new things. This is a test of change, so we'll be trialling lots of new things over the next 6 months and be excited about sharing that with our learning collaborative. And I think as an improvement journey also, part of the learning is really around the story that builds up as we go through each iteration of this, that is really valuable learning for others. And it'll be very interesting for us to be able to really walk through some of this with from a customer perspective and really capture their stories as much as we wish to capture our story. And I think the important part for me is, you know, as Anne has described, there are many dimensions of what we're trying to achieve in the coming 6 months. But I'm confident that it will be a project nationally that helps us really identify where is the added value in this and how can we improve both our connectivity and working across partnerships to improve the outcomes for the citizens in Scotland. Thank you very much.
Thanks very much, Lynn, and also thanks to Julia, who, as you could tell from our presentation, fully intended to be here today to take some questions live, but sadly isn't able to join us. But I would say we're now well connected with Julia and our colleagues in Wales, so do get in touch if there's any specific things you'd be keen to learn more about, and we can maybe help you as we progress the work we're doing in Scotland. So can I just say thanks very much to those of you who've put some questions in the chat box. If we've got time to go through a couple of them, I think now. So I was just going to start. Rachel Mackay from West Lothian. Thanks very much, Rachel, for your questions. First of all, you were asking, are you able to share who's participating in the collaborative? And I think it's now kind of common knowledge who we're working with, so we're fine to share that with you. Just to say, back in September, TEC issued an invitation to all health and social care partnerships and housing association and cooperatives to apply for funding to be a test of change site. So hopefully everybody's had the opportunity to get involved there. And we're now, originally it was going to be 3 partnerships, but we've increased that to 4 now. So we'll be working with Bield, obviously. And as Lynn says, Bield will be working with Midlothian in Renfrewshire. We're going to work with Dumfries and Galloway. We're going to work with colleagues in Stirling and colleagues in City of Edinburgh. So probably four different projects, different pieces of work, but with a lot of commonalities. And I think that's where the learning collaborative comes in, a real opportunity to learn together and potentially collaborate in some aspects of the projects there as well. And maybe just to say in that respect that although initially the focus of the collaborative will be in the test sites, we do plan to open that out over the 6 months and involve others so that we can share learning and get others' views in that as well. I think when I look at other questions, Lynn, there's one here from Doreen Watson. She's asking, how do you plan to support your workforce to have good conversations? Oh, I think you might be on mute, Lynn.
Thank you. How many times have you heard that in the last 6 months? Thank you for that question. For the proactive telecare test of change, we're actually going to do some formal training on good conversations. And so that's something that we're going to do to really increase our, increase the staff's knowledge and ability to have these personal outcome-based conversations. During COVID, it was a different staff group. It was the customer services staff that were actually doing the outbound calling, and so many of the people they were calling they already knew, and they were slightly different in that they were check-in calls. So they were just looking to check in with them, find out what they needed. And obviously we were working towards our own customer experience standards around listening and focused on what the individual actually wants to achieve.
Thanks very much, Lynn. I think I'd maybe add to that. I think we do appreciate this is quite a different way of working, and what we're trying to do as well within the collaborative is to link in with other organisations who have got good experience of having this kind of conversation. So, for example, we're linking in with Empower, which, in fact, I think there's a project, a session just starting now in Empower. And we're also linking in with the Alliance, because obviously they've gained a lot of experience through their Links Worker programme as well. So really trying to identify others who we can learn from, as well as providing the kind of training that Lynne described there. I think maybe one more. It's more of a comment rather than a question, Lynne, but I think it's probably aimed towards you. Thank you, Morven, for your questions. You're saying your presentation's really interesting, Lynne. I wasn't aware of Bield's work before. In terms of working more collaboratively, I think there is crossover with some of Marie Curie's services, including befriending, practical help and bereavement support, which your clients could benefit from.
Thank you very much for that, Morven, and happy to link with you out with the session. Thank you.
Thanks, Lynne. And I think for me, as I say, that there will be 4 quite different pieces of work, and for me it's all about making those local connections. So for the Telecare services to identify locally who it is they could potentially be working with more closely, and I think that integrated approach is really exciting for the ongoing development of Telecare services as well. So I think we've addressed the questions we can in the chat box, and hopefully we've made a few connections as well, and we'll be back in touch with some of you. So if I could just again pass on my thanks to Julia, who, as I say, is unable to be with us today, but I hope you agree is doing some really interesting and exciting work in Wales. And thanks also to Lynne for giving us your thoughts on the test of change, and for taking some questions at the end there, and look forward to working with you over the next 6 months. Thanks everybody for joining.
Thank you very much.